My name is Amy Helder, and I am the Administrative Director for Patient Experience here at The Ohio State University Wexner Medical Center. One of the things that we're very focused on here at The Ohio State University Wexner Medical Center is taking a patient and family-centered approach. And so we really identified an opportunity for us to connect in a meaningful way and in a personalized way with patients when they are in our care. And so as part of our work with the Ambassador program, we were able to identify what data we currently have about patients who are visiting with us and what our performance tells us about their experience with us. And we were able to develop a predictive model that helps us to identify what is most important to patients and how we might initiate conversations with patients to make sure that we're meeting them where they are and making sure that we're contacting them in a way that's meaningful to them so that we can deliver on personalizing their care and meeting their needs in a significant way. So we were very pleased with the results of our Ambassador program. We were able to see a positive result, favorable performance in terms of how our patients were perceiving the care and services that we're providing. And so it was really fulfilling for us to be able to connect with patients in a way that's meaningful for them.
The personal and meaningful connections that Amy spoke of were guided by a sophisticated data analytics technology developed at the Medical Center. Good afternoon, I'm Tim Newcomb, and in 2013, Clayton Daly and I licensed this important technology from the university and formed Ambassador Software Works. Clayton and I possess, between us, 4 decades of combined startup experience, and I had just recently concluded a successful exit for the investors of my prior startup. Our work to advance this technology revolved around a patient satisfaction survey developed by Medicare. This survey is presented to patients shortly after their discharge from the hospital. It measures attributes like, was the environment clean, or would you recommend this hospital? And it generates a composite patient satisfaction score. Out of this work, we created the Ambassador Patient Experience Amenity, or APEX for short. Let's take a look at how it works. The APEX integration engine receives up-to-date patient data from the hospital's electronic medical record system and passes that information to the prediction algorithms which identify patients who are at risk for a poor experience. APEX workflow engine then prepares patient-specific recommendations for their non-clinical care. Caregivers access a list of their patients on a handheld tablet. They simply select a patient and are presented with recommended workflows for their non-clinical care. And those workflows guide a patient conversation and recommends actions to address the needs of that specific patient. APEX helps caregivers deliver the right patient experiences to the right patients at the right time. You might be thinking at this point that improving patient experience and raising patient satisfaction scores are admirable goals, and they certainly are, but there is another dimension to consider. Medicare uses the survey results to drive a ratings program that has financial consequences for hospitals. Let's take a look at what this might mean for Ohio State's Wexner Medical Center. OSU's total patient revenue for a year is $2.6 billion, of which $250 million is subject to reimbursement by Medicare. Medicare imposes a 2% withholding of that amount to fund its incentive program, and that looks like a $5 million problem for OSU. Our early business plan reasoned that most hospitals would be willing to invest a small percentage of their at-risk dollars to improve results. But we learned that there is a much bigger problem, and it is this. Consumers are using these publicly reported scores, like you see here, to compare hospitals. Whoop, how about there? And how about there? And how about there? There they are. They're using these publicly reported scores to compare hospitals and choose their hospital. So let's see, if you were this consumer, would you take the 2-star hospital on the left, or would you pick the 5-star hospital in the middle? This certainly changes the calculus for Ohio State. So let's say that 1% of the total patient revenues lies in the balance of consumers deselecting the hospital based upon their ratings. For OSU, that's a $26 million opportunity. Now, the marketing budget that is used to attract or retain customers for a hospital like OSU averages to be $19 million on an annual basis. These three items taken together are strongly influenced by patient satisfaction ratings, and together they look like a $50 million problem. Just think of what that looks like for the 3,000 hospitals in the Medicare system. Would each of those institutions invest a percentage of that amount to gain on their competitors? They certainly would. Apex raises patient satisfaction scores and is well positioned to prosper in this domain. Following our successful beta launches, we are now deploying to paying customers who will use Apex to inform their patient interactions, improve their patient satisfaction scores, and prevent themselves from appearing on Yelp as worst hospital ever. I appreciate your attentiveness, and I look forward to meeting you at our display area when these presentations conclude. Thank you.